Okay. Good afternoon. Thanks for being here for the latest update on the COVID-19 response in Colorado Springs. Let me start by sharing my appreciation for all of our citizens who are doing their part to fight this virus by staying home and practicing responsible physical distancing. As you're aware, last night, the governor of Colorado extended his stay-at-home order until April 26th. That was a prudent decision based on the advice of health experts, and I'm fully supportive of it. The governor's orders are an important step to flatten the curve and ensure our hospitals and medical resources are not overloaded, and we can begin to return to normalcy as soon as possible and begin the economic recovery. At the state level, just like at the city and county levels, officials are analyzing a constant stream of data to make the best decisions possible in limiting the impact and the length of the impact of this public health emergency. Locally, El Paso County Health has done predictive modeling that shows a dramatic reduction in the number of cases that will result from abiding by the stay-at-home order and practicing safe social distancing when out doing essential tasks. We're pleased that the number of hospitalizations and positive tests has declined in the last several days, and we hope that that trend continues. Obviously, continued data analysis will determine if the stay-at-home order can be lifted or modified on April 27th. I spoke to the governor after his announcement last night, and based on state health department analysis, he was optimistic, and I join him in that optimism. But the only way to get past this quickly is by obtaining full compliance with the stay-at-home order now through April 26th. Failure to comply will only extend this difficulty and increase the negative impacts on our community's physical, mental, and financial well-being. It's for that reason we beseech everyone to please abide by the order. I'm confident the city of Colorado Springs and El Paso County will rise to the occasion. Every day, there are citizens doing just that here in our city. Today, we are at the Office of Emergency Management, accepting our first rounds of donated cloth masks to be used by public safety and essential officials in non-emergency situations. These have come in from sewing groups, church groups, veteran groups, and individuals. We put out a call for help, and this city answers. In Colorado Springs, that's just what we do. We're seeing improved compliance with responsible social distancing in our parks, allowing us to keep those open as a healthy outlet during these stressful times. Last week, we saw the United States Olympic and Paralympic Committee donate over 18,000 pounds of food previously bound for the Athlete Village in Tokyo to our local food bank, Care and Share. And then there are our first responders who always rise to the occasion in times of crisis, who are shining examples of commitment and responsibility. And what can we say about our medical professionals on the front lines? They're doing a tremendous job, and we're greatly indebted to all of them. Our police and fire chiefs are here today, and shortly they will share with you what they're doing to protect our city's public safety professionals. Just before issuing the extension of the stay-at-home order, the governor made a strong recommendation that we all wear face coverings when we go out in public. I'm on board, and I hope all our citizens are on board. In fact, I'm going to put my face mask on in just a moment. Here to explain the ways and hows of face mask usage, I'd like to bring up Dr. Leon Kelly from the El Paso County Health Department.
Good afternoon. As was mentioned by Governor Polis yesterday and then reiterated by Mayor Suthers now, we have seen encouraging information coming out as far as the number of cases we're seeing and the number of hospitalizations that are happening. So we want to thank our community for buying in to what we're asking you to do and make the sacrifices that you have. We are seeing the positive effects from that, and now more than ever, we need to continue those efforts. I'm here mostly to talk about face masks, and we've had lots of discussions and lots of good questions about where we're supposed to use them and when we're not. There's a couple key important points. One is this is merely a recommendation asked by our governor and our public health departments. This is not mandated and it's not an order. So we are asking our citizens to volunteer. Secondly, the purpose of a face mask is largely to prevent spread from you to other people. It's not necessarily going to protect you from other individuals who may be sick. It's important to know that because the materials we're asking folks at home, first responders, non-medical, is to use homemade masks if you can. The reason being is we need to preserve those proper PPE, the tested and appropriate medical devices for the folks that really need it, the folks on our front lines. CDC.gov has several great examples of how to create masks out of homemade materials. You don't need to have any sewing skills at all. And so those we're being asked to use, we're asking folks at home to use those so that we can, once again, preserve the proper PPE for our community. Now, the circumstances that you're gonna wear them, most of us should be staying home. We should be social distancing. And so the masks do not need to be worn at home. They do not need to be worn in your vehicle. They do not need to be worn when you're around your normal family that you are isolating or staying at home with. The masks need to be used only at times where you leave the home and our social distancing practices can't be followed, or you're concerned that they may not be able to be followed, like when we go to the grocery or for some of those essential services. If you're at home and you're outside in your own yard and there's no one around you other than your own family members, you do not need to wear the mask. If you're going out to a location where you can't assure 100% that you are not gonna be within 6 feet of other individuals, that's when it's appropriate to take the mask. We're asking all citizens to wear masks who are over the age of 2 years old under these circumstances, as long as they are able to breathe. They don't have any lung problems or anything that makes breathing difficult. Once again, the use of the mask cannot be a replacement for the things that we're asking you to do. This is not a replacement for proper social distancing. Wearing the mask does not prevent you from getting the virus if you are going out and not following the rest of the orders and the recommendations that we have for you. So we have had incredible buy-in from our community. We have lots of folks volunteering to make masks. The mask that I'm wearing today was given to me by a friend who made it with her daughter. And so, as things come up, we can have some really common sense answers to when you should and when you shouldn't wear the masks. Public Health Department is always available for those questions. Please check our Facebook page or the website for further recommendations. And once again, thank all of you in El Paso County and Colorado Springs for the efforts and the sacrifices that you're making. And as we continue to work through this, we are once again seeing positive effects of all of our activities. And so thank you.
Good afternoon. I'd like to take a minute to thank those organizations who have provided personal protection and masks to our employees. Our thanks go out to Shield 616, the Next Door Face Masks of Woodmore and Kathy Kemp, along with their over 90 volunteers. Sew in Tune, High Country Quilts, Piercing Partners Quilt Guild, and Forest Gate Presbyterian Church. Words cannot describe how much we appreciate your support for all of our employees with all the masks that you have provided us. We will continue to need fabric masks, so if you want to donate to those in the front lines, you can bring them to the Pikes Peak Regional Office of Emergency Management, located at 3755 Mark Dabbling Boulevard, between 1 and 4 p.m. on Tuesdays and Thursdays. The Colorado Springs Police Department has put several protocols in place to protect our citizens and our employees alike. We are allowing officers to answer calls for service over the telephone when it is possible. This limits the amount of contact we have with the public, but we can still get the job done. We have provided our employees personal protective equipment, and we keep them updated on the proper way to utilize that equipment. We are allowing both civilian and some sworn employees to work from home as long as it does not impact our daily operations. This will not impact our ability to have officers on the streets to answer calls for service. The deputy chiefs have developed a COVID response directive that is updated regularly, and that document provides all of our employees guidance on responding to calls for service, to how to properly wear protective equipment. It is an encompassing document. We continue to ask citizens to not call 911 for non-emergencies. Please do not call 911 to report violations of the stay-at-home order or mask recommendations. Those lines must be left open for emergencies so we can respond in a timely manner to those that need us the most. Please, please do not call 911 and clog our lines. I do want to thank everybody for your continued support for CSPD and the city of Colorado Springs. Thank you. Now I'd like to introduce Fire Chief Ted Colas.
Well, I'm going to make it easy and just pull it down. Struggling with that, I apologize. Well, good afternoon, everyone, and thank you for tuning in to get this update on our COVID-19 response in the city of Colorado Springs. I want to assure everybody that the Colorado Springs Fire Department is on duty, ready to respond to your emergency. Like the police chief just said, we really appreciate you and appreciate all of the people in Colorado Springs for calling when it's a true emergency and not calling for those things that could be handled by themselves at home. We're seeing a great response from our citizens, and we are so very grateful that everybody is prioritizing those calls. And when you call 911, you'll see our firefighters arrive at your home if there's a medical emergency, but they're gonna arrive looking a little bit differently than they have in the past. You've seen pictures on the television about people who are wearing their full medical PPE, and that's how your firefighters are gonna show up at your door. They'll have on goggles and face protection and masks and also a gown and gloves, and they'll look a little bit differently, and we're going to respond a little bit differently. We'll have one firefighter make contact with the patient, and unless, of course, there's a medical emergency that warrants more hands-on care, and then, of course, we have the whole team to jump in. But we're doing that to limit the exposure to our firefighters and also to conserve our personal protective equipment so that we'll have it for a prolonged period of time, because none of us really know how long this emergency is going to last in our community. On fire calls, we're gonna look largely the same. We're gonna wear that bunker gear you're accustomed to seeing with a big tank on our back, and we've been responding to those calls, and there'll be no difference in our emergency response. Another thing that we're doing to take care of our firefighters and make sure that they're well informed, like the police chief mentioned, his deputy chief putting out a daily reminder, we're doing much the same thing on the fire department. Both a medical update and a operational update are going out almost daily, along with almost daily broadcasts across to our firefighters in our 22 different fire stations, making sure that everybody is up to speed with the latest and best techniques for dealing with this emergency. One of the other things I'd like to remind you of while I've got your attention is that while we're spending a lot of time at home, we'd like to remind everybody to remain fire safe in your home. Please be careful when you're cooking. Unattended cooking and getting distracted by maybe having more people in your house than you're accustomed to, those can lead to tragedies. So please make sure that you are paying attention while you've got food on the stove. We don't want to see anybody find another emergency that would complicate what they're already going through. Along with that, discarded smoking materials is really one of our largest concerns for fires. Not only wildfires, because somebody carelessly discarding a cigarette out of a vehicle, but those discarded cigarettes in planters outside and putting them in containers that they're not designed for. We've seen numerous structure fires that are resulting from those kinds of things. So please be careful in and around your home while you're social distancing and while you're staying isolated with your family members in the home. We want everybody to be safe. Finally, I'd just like to reiterate what the police chief said, and that is to thank everyone who has donated masks. people who have donated fabric and people who have donated masks for the safety of our first responders. We can't tell you how grateful we are. You making us safe enables us to help make you safe, and that's really why we're here. Thank you again for your attention this afternoon, and I think we're going to open it up in case anybody has questions for any of the speakers today.
For the people that are making their homemade masks, what's the best way to clean it, and how often should they be doing that?
So the question is what's the best way to make the masks and how do you clean them? We're kind of all figuring this out as we go along here, but once again, the goal is to keep those respiratory droplets inside the mask from your own mouth and nose. So number one, you want a fabric that's relatively tight weave, so typically just traditional cotton, so cotton t-shirts, bed sheets, anything like that can be used. One of the great things about the fabric masks as opposed to the surgical masks and things is that they are reusable, and so you can wash them over and over and over again. And so you can wear it during the day, and then at the end of the day, put it into the wash and just normal washing machine, normal hand soap, or normal dishwashing detergent. If you don't have a washing machine, under warm temperatures is more than enough to wash away and kill the virus. So if you have a couple that you've been able to make or get a hold of, you can just keep those in a rotation. The key parts about wearing the mask is, the respiratory droplets are inside the mask. That's where the virus is. So you want to make sure what you're not doing is touching your mask, fidgeting with it, taking it on and off over and over again, and then touching it with your hand. So if you do have it around the head or the nose, you want to reach in and pull it off around the elastic, not from the front or the nose area. Pull it off, and then when you go to put it back on that same way. If you are taking it off and you need to put it down or put it in your pocket, you want to fold it so that the inside folds in, so that the dirty side is facing the dirty side. And then when you pull it back out, you open it back up without touching the face or the inside, and then you put it back on. That's how healthcare workers use our masks, and the same recommendations will work for folks at home.
County health officials monitoring.
So we are taking a very active role from the public health perspective, monitoring our jails and offering both technical support as well as testing. The largest jail we have here in El Paso County is the CJC, the Criminal Justice Center. And I'm the liaison directly from public health to that group. We are doing testing on symptomatic inmates in the jail. We are now working with UC Health directly to increase the amount of testing that we have available, as well as the turnaround time for those tests. The inmate population is a very special population, in that obviously they can't, under most circumstances, follow the social distancing guidelines. And so we need to come up with other ways and be very, very diligent in our testing of those folks, isolating them, getting symptomatic people separate from each other. And we've got really good plans in place, and we'll continue to work very hard every day in keeping those folks safe.
The Gazette asks for the mayor, are we still seeing a lot of people visiting our city parks, and do you see that as a health hazard?
Yes, we're seeing a lot of people visiting our city parks, but the good news is, if you remember last week, I kind of gave the advice to spread out, and they appear to be taking that advice. They're not all going to the same parks. We've been monitoring the numbers at Garden of the Gods, and over the last week, even on the very good days, we've had lower numbers than we've had in the past. There's lots of people. On the way up here today, I saw an incredible amount of people on the Santa Fe Trail biking, but they do a pretty good job of social distancing. So yes, a lot of outdoor activity, but people seem fairly serious about social distancing. We're monitoring very carefully the public golf courses. As you know, we've reduced the number of tee times in half to spread out so people aren't waiting together on the tee. And people seem to be very disciplined about it. And so I can tell you we're happier than we were last week in terms of the social distancing taking place in the parks. Most of our complaints revolve around our pickleball and tennis courts and the fact that everybody playing together, to at least the people calling in to complain, don't appear to be family members. And we just ask for compliance there. We've got people in the parks, rangers and officers that would otherwise be in the schools, contacting people, and that'd be a typical question they would ask. Are you all in the same family? But overall, I would say we're pretty well pleased with the level of compliance we're seeing in our parks in contrast to past weeks.
Tell us about or since the out Colorado. Have you seen any reductions, or have you seen an increase in?
We have talked to our employees, our sworn employees, about utilizing felony summonses when they can. Felony summonses, there are guidelines about when you can and cannot use them. Right now, I can't tell you if there's been an increase in those numbers. I'm actually having a briefing on Thursday from our analysts to tell us where we stood in March. I can tell you anecdotally, I've been hitting lineups, and most of the officers in the lineup say that they have seen a reduction in the number of calls for service that they're responding to. They have a little more free time to train our new employees. We have a recruit class that's out right now in PTO training. So there's a little more time. They're actually a little appreciative for the time, but they're not seeing the amount of calls they need to do a sufficient amount of training with those employees. So it's kind of a give and take right now.